Hello everyone, this is a brief video for patients who suffer from long QT syndrome, either inherited or acquired. I'm sure you must be very concerned about the coronavirus pandemic and the impact that the coronavirus illness could have on you. The most important aspect of long QT syndrome is the effect of medications. As I'm sure you all must have been told by your cardiologist, that you have to be very careful as to which medications you start on because a number of medications have the potential to prolong the QT interval and put you at risk. This is particularly relevant today because many medications have been approved for use either to treat patients who are suffering from COVID-19 infection or to prevent the manifestations of the infection in case they have been exposed to family members or for healthcare workers who may have been exposed to patients as part of the day-to-day work. Some of these medications have the potential to prolong the QT interval. For example, chloroquine, hydroxychloroquine, or azithromycin. Now, the good news is that the QT prolonging effect of these medications is modest, and by itself, they should be not a problem. The problem arises when they are used in patients who already have inherited or acquired long QT syndrome, or when these medications are used in combination with each other, or when these are used with antiviral agents in patients who are in hospital with long QT syndrome, with COVID-19 infections. So the current scientific advice on this is that if you are known to have long QT syndrome, either congenital or acquired type, then you should not start these medications without at least getting a baseline 12-lead ECG and ensuring that there is no evidence of QT prolongation on that ECG at baseline. So you need to get an ECG done. Your cardiologist or your doctor will need to have a look at it, make sure that the corrected QT interval is normal or at least less than 500 milliseconds or half a second. And if that is the case, then you can start this medication. If on the other hand, if you suffer from one of these conditions, then you really should not be starting these medications on your own until and unless you get medical advice. Also, when you start these medications, you need to get a 12-lead ECG recorded 24 hours afterwards to make sure that the QT interval hasn't gone out. So just to recap, if you do not have a long QT syndrome, then you can start on these drugs, but you then need an ECG after 24 hours. If you are known to suffer from a long QT syndrome, then you need to get an ECG at baseline, make sure that the QT interval is not prolonged, and then you can start on one of these drugs. But again, you need to have a follow-up ECG done a day later.